So currently we have quite a low number of cases here in Gibraltar. That's reflecting that many people are no longer testing, and that is not unexpected. Sadly, over the last few weeks we've seen a couple of deaths of individuals who did have underlying health conditions and contracted COVID and sadly passed away. And that is a reminder to us that COVID has not gone away. It is circulating in the community, hence why we are constantly reviewing our guidance and looking at where we can ease restrictions, we do so.
As you say, as from Thursday, self-isolation will be reduced to 5 days. We've seen other nations gone the way of normalising, if that's the word I can use, the COVID situation, in terms of if people test positive for COVID, there's no need to self-isolate if they're feeling fine, and they're being asked to wear masks and to go about making their daily life as normal as possible. Why perhaps is this not being applied to Gib?
So in Gibraltar we are different. We live a very interconnected life, lots of social contact, and it's quite a small geography. Hence why we're still taking that precautionary approach. You raised a really good point there, and why I said mostly symptom-free. The advice in many countries is if you've got symptoms, please still self-isolate. I'm concerned that may not happen, but the reason I say mainly symptom-free is we know that people can have quite a long, prolonged cough post-COVID. So that's why I'm saying, mostly symptom-free. After the 5 days, if you're testing negative and your temperature is settled, your symptoms have settled, you can then come out of self-isolation.
And in the next few weeks, change of season, we're heading into the autumn. Colds are prevalent, it's that time of the year. People are not testing. Perhaps it's going to be difficult for people to gauge whether they have COVID or not. Is the whole testing scenario perhaps going to be reviewed ahead of the autumn-winter months?
So we're actively planning ahead for our preparations for winter, because like many countries we are expecting that there will be seasonal flu, norovirus, COVID, respiratory syncytial virus, and it's that layering effect of all of those viruses means we have to plan for quite a tough winter. Absolutely, we constantly keep under review what our measures are, and what I'd actually encourage people as well is, even if you test negative for COVID, think about there might be other infections out there. As we head to the winter, there might be seasonal flu, which has similar symptoms. If you have those symptoms, think about, should I delay going to see my relative or loved one in ERS, for example, or in the hospital? So we're asking people to be vigilant for symptoms and act responsibly.